Here is the synthesis of the 5 related articles of my mini research. The title of my mini research is Integration of Disaster Risk Reduction in the Junior High School Science Curriculum, Basis for Assessing the Academic Performance and Biorhythm of the Learners in the New Normal Education. Here are the 5 related articles. First article is entitled Effectiveness of Disaster-Based School Program on Students' Earthquake Preparedness. For the research gap of this study, I have here studies focusing on the effects of school disaster programs in actual preparedness, however, have remained limited in developing countries except for Nepal and Iran. Because the characteristic of disasters and education systems in Indonesia are different from others, this study will be valuable in reaching the different perspectives of DRR in the educational sector. For the research objectives, the present study assesses the effectiveness of disaster risk education in schools by comparing students in 2 junior high schools regarding action taken in earthquake preparedness and major factors of disaster preparedness such as risk knowledge, risk perception, critical awareness, and attitude. For the research design, the study used correlational research. For the data analysis, thematic approach, the quantitative data were supportive with qualitative data, and the data were treated with a statistical treatment that is MANOVA, which means multivariate analysis of variance. For the results and conclusion of this study, first, the effectiveness of disaster education programs in relation to knowledge is seen from the higher number of students giving correct answers, such as any time in response to the occurrence of earthquakes. Another one, there was also a greater number of students responding correctly when they were asked how to prepare for earthquake hazards, such as establishing emergency plans, preparing toolkits, preparing food and water, keeping emergency phone numbers handy, fastening furniture to keep it from moving, and placing heavy objects on lower shelves. Another one, the effect of disaster education on other major factors correlates with disaster preparedness such as risk perception, but critical awareness, attitude toward preparedness behavior were other important findings. And the increasing number of major factors in earthquake preparedness has not been transferred to actual preparedness behavior, which was one of the expected goals of disaster education program. Another result and conclusion of this study, efforts should be made by local government officials, teachers, and other stakeholders to evaluate and develop public education in school focusing on increasing preparedness behavior. For the second article, the title is Dealing with Sleep Problems During Home Confinement Due to the COVID-19 Outbreak, Practical Recommendations from a Task Force of the European CBT1 Academy. For the research gap of this study, in this short paper, we want to address possible consequences of this home confinement situation on sleep and to give practical advice on how to handle sleep problems. The study will not focus on the negative consequences of the long-term home confinement upon sleep quality, but also on those confinement consequences that might, in particular situations, benefit sleep quality and daytime functioning. For the research objective of this study, to discuss those effects of the current home confinement situation that can disrupt sleep, but also those that could benefit sleep quality. Another, to suggest adaptations of cognitive behavioral therapy elements that are feasible to implement for those facing changed work schedules and requirements, those with health anxiety, and those handling child care and homeschooling, whilst also recognizing the general limitations imposed on physical exercise and social interaction. For the research design, the study used qualitative research design. And for the data analysis, thematic analysis were used in analyzing the data. And for the results and conclusion, first one, it was found out that in the study that isolation at home during the COVID-19 pandemic causes sleep problems among individuals, and several factors were identified as the causes of sleep problems to individuals during home quarantine. Several recommendations were given to the different groups of individuals to address sleep problems. Now, for the third article, I have here outcomes for children as a result of DRR activities supported by the EEPCT, United Nations Children's Fund, New York. For the research gap, DRR in education directly addresses risk factors that greatly contribute to communities' vulnerabilities in the face of disasters, including poor building quality, limited understanding and awareness of risk, and a lack of capacity to prepare for, prevent, and respond to hazards. For the research objectives, the aim of this study was to assess and document the outcomes for children as a result of the DRR activities supported by the EEPCT program. For the research design, the study used qualitative research design. The data analysis, the data were analyzed thematically. And for the results and conclusion, first, the evidence gathered during the course of this research clearly points to positive outcomes for children as a result of the integration of DRR into education. Another one, while it was not always possible to document the specific outcomes, for example, in the two countries' case studies where disasters had not struck since the time of implementation, it was very clear that significant change has occurred at both the national and the local levels, which is leading to increased education and greater preparedness and resiliency among communities. Another one, specific outcomes documented included greater preparedness among children, the ability to identify and address risk outside of disasters, continuity of education, and a greater sense of security and confidence. Further outcomes at the community level include safer school buildings and greater awareness of risk management. For the fourth article, I have here disaster risk reduction knowledge of grade 11 students, impact of senior high school, disaster education in the Philippines, Las Piñas City National Senior High School, Division of Las Piñas City National Capital Region, Philippines. So this time, DRR knowledge was measured to the senior high school students using Philippine setting, because as what you've observed, the first three articles was outside the Philippines. The setting was outside the Philippines, and this one for the fourth article, I have here the Philippine setting, and the respondents were the grade 11 students of Las Piñas City. For the research gap of this study, the study was conceptualized to determine the DRR knowledge of grade 11 students in the Philippines. For the research objective, it aimed to assess the disaster-related knowledge, preparedness and readiness adaptation, awareness, and risk perception of senior high school students. For the research design, the study used cross-sectional study design using simple random sampling technique. For the data analysis, thematic analysis using quantitative data supported with qualitative data and statements. For the results and conclusion, first, responses in all cases of disaster awareness and risk perception are significantly different. Another one, most of the students are aware on DRR at local, regional, and national level because of various disaster awareness campaigns, and most of the respondents are aware on the importance of building or infrastructure retrofitting. Also, the responses of grade 11 students in this study reflect how K-12 curriculum and other educational programs of DepEd are effective in addressing DRRM. Grade 11 students understood some disaster-related concepts and ideas and are prepared, adapted, and aware on the risk inflicted by these natural hazards. Also, low perception on disaster risks are evidently observed among senior high school students. Another, the responses of grade 11 students in this study reflect how K-12 curriculum and other educational programs of DepEd are effective in addressing DRRM. And also, the responses of grade 11 students could be based on the efficiency and impact of the integration of DRR education in the senior high school curriculum, specifically integration of the concepts about the hazards, hazard maps, disaster preparedness, awareness, mitigation, prevention, adaptation, and resiliency in the science curriculum possibly affect the knowledge and understanding of students on DRR. Now we're down to the fifth and the last article. The title is Disaster Risk Reduction Strategies, Navigating Conflict, Context, Working and Discussion paper. The research gap. This paper is based on the premise that to be effective, strategies must be tailored on their context. The research objective, it investigates whether DRR strategies, frameworks, tools, and approaches make reference to conditions of conflict, and if so, how. For the research design, the study used qualitative research design. And for the data analysis, it was a combination of a systematic keyword search and a content analysis of DRR framework, strategies, and policy documents across scales, including global, regional, and national level. For the results and conclusion, the research found no clear patterns in or how DRR strategies neither considered conflict nor are there clear connections between policy levels. Another one, conflict is not explicitly considered in global frameworks, and at regional and sub-regional levels, there is significant variation in how conflicts addressed. Also, the research also found that regional strategies do not necessarily determine how national strategies are formulated in terms of how conflict is addressed, so the research did not intend to contrast national to regional scale. That's all about synthesizing 5 related articles of my mini research. Thank you.